Welcome to the Pure Wellness Podcast, where we talk about what it takes to live a holistic lifestyle by making conscious, healthier choices. Our hope is that these discussions will inspire you to strengthen your daily practice to improve overall physical, mental, emotional, and social well-being. Pure Wellness Podcast provides information solely for educational purposes and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. I'm your host, Johanna Altman, founder of One Body Medicine, avid health enthusiast, and mother of three. Join me and industry professionals as we explore human potential in the pursuit of pure wellness. Welcome, everyone, to the Pure Wellness Podcast. And here with me, I have Dr. Allen. And for those of you that might not know who he is, he's the medical director to One Body Medicine. So thank you so much for being here.
Happy to be here.
Amazing. So for this episode, we're going to be discussing something that is very relevant right now, cold and flu season. And I just want to dive right in with some questions, if that's okay.
Let's do it.
Okay. So why do they call it cold and flu season? And why is it prevalent more in the winter months?
So first, let's talk about what we mean by cold and flu. A cold is just a blanket term to describe a viral upper respiratory tract infection. It could be caused by one of over 200 different viruses that scientists have identified. Of those, mainly from the family of coronaviruses, adenoviruses, and rhinoviruses.
Coronavirus? What? Okay, can you elaborate on that? Because when I hear coronavirus, I think COVID for some reason. Are those associated?
So COVID is a coronavirus, which is basically just a family of viruses that is identified by the types of proteins that are on the surface. Colds tend to be characterized by symptoms such as runny nose, cough, sore throat, and sneezing. When we say flu viruses, that we're talking about the influenza virus family, and they also tend to be characterized by similar symptoms, but more often than not with high fevers, body aches, fatigues, things like that. But there's a lot of overlap.
Okay. I'm too familiar with flu and cold symptoms, unfortunately, because my kids are always getting sick. So when is it important that we go to the doctor? When symptoms, you just described the symptoms. Do we go, for example, for a flu, the first instant of a fever? Do we wait a few days for it to, for our body to fight off the infection? When do we go to the doctor?
The choice to go to the doctor depends on underlying factors, whether or not you are generally a healthy young adult versus if you have chronic diseases or you're an older individual, as well as the severity of your symptoms. So definitely for symptoms such as dehydration, if you have a really high fever that won't go away for a long period of time, if you have trouble breathing or chest pain, those would be some of the main reasons to go to a doctor.
Okay, so you had mentioned temperature for a period of time. So what is that? 1 day, 3 days, 5 days? So when should we go to the doctor if we've experienced a temperature for how many days?
I wouldn't say that there's a definite cutoff.
Okay.
You would just look for the general cues of how you're feeling and what the other symptoms associated with that are.
Okay. And I just remember whenever people would say, are you on antibiotics? Because maybe I had a cold or a flu. It was something that I really didn't understand why antibiotics seem to have been closely associated during cold and flu season. So could you explain in more detail when is it necessary to take antibiotics during this season?
Yes. Generally, antibiotics do not treat viruses. They treat bacterial infections. So it's a misconception that if you get a cold or a flu that you should take antibiotics. As a matter of fact, most of the time, you wouldn't. The only indication would be if you have a concurrent bacterial infection, such as a pneumonia, that you would want to be on the antibiotics. Now, a lot of people go to the doctor and they're worried about a bacterial infection and they get prescribed an antibiotic, for example, a Z-Pak or azithromycin, which is the proper name for it. Mm-hmm. A lot of people who take those antibiotics seemingly get better when they take them, even though they have a viral infection. And there are various reasons for why that might be. Usually when somebody goes to the doctor and they have a flu, they're already at the height of their illness. That's when they're feeling the worst. But from your body's standpoint, they're already starting to recover from that infection. Mm-hmm. Now, remember, antibiotics take at least a day to start working. And by the time the antibiotics are in their system, their bodies are naturally fighting off the infection already, which is why they think that they're getting better from the antibiotics. Other reasons might be because if they do in fact have some kind of underlying bacterial sinus infection or a pneumonia that's contributing to it, that might be a reason why. But some antibiotics, such as the Z-Pak or azithromycin, also have a strong anti-inflammatory effect.
I see.
And so that might also help some of their symptoms, even though it's not treating the cause of their illness.
That makes sense. So at the moment, they might seem to get better, feel better because of all those other reasons. And I wonder, maybe that's why, because my husband, I remember Matt, whenever he would get sick, he would be the first patient to go and see his doctor and say, "Can you get me a Z-Pak? I'm not getting better. Can you get me a Z-Pak?" And I felt like such a handicap for him. Every year he was on antibiotics at least once or twice a year until he wasn't getting better from these antibiotics. He would feel better and then maybe 45, 60 days later get sick again. And it became something he was reliant on. And isn't that not good for us, taking too many antibiotics?
There's a couple big reasons why you wouldn't want to take antibiotics with a virus. The first being antibiotic resistance, because the bacteria that you're naturally exposed to and that lives in your body may come in contact with the antibiotics and develop a resistance to that. So that later on, if you were to have a bacterial infection, that antibiotic might not be as effective. Another reason why is because antibiotics actually have a very negative effect on your gut microbiome. So that can cause, in the short term, GI side effects, but in the long term, gut dysbiosis, which is a imbalance in the types of bacteria that are living naturally in your body. And that can lead to additional problems also.
Because now we know that gut biome and bacteria is one of the main things responsible for our health, correct?
Correct. Because your gut is constantly exposed to different types of pathogens, it actually plays a very important role in training your immune system and in regulating your immune system.
Understand. Okay, so a few more questions I have. For example, another thing that my mother always told me whenever I was sick is make sure you take 1,000 milligrams of vitamin C every day. You're going to get better. So does taking vitamin C while you have a cold or flu help you get over it faster?
There have been some studies that show that taking large doses of vitamin C, and we're talking up to 8 grams of vitamin C in one day.
Now, what's 8 grams in milligrams? Because I don't really
So a
understand.
gram is 1,000 milligrams. So that would be 8,000 milligrams. And I'm not always an advocate of taking such a high dose of vitamin C, but there have been some studies that show some benefit to that. There was actually a 2012 review of the literature by the Cochrane database that shows that there actually isn't much of a reduced duration of illness with taking vitamin C. So I would say that the evidence is not strong.
Yeah, it's just something to help us feel better, I guess. That maybe the symptoms will subside with something that we can do and help put in our body. So one last question I have. What are some preventions and what are things that we can do to try to not catch colds or the flu so easily? Is there some type of hygiene, or does cold weather even make us sick? I've heard that as well.
So the cold weather causality has been debunked. And you have to have exposure to a pathogen in order to get a cold or a flu. The reasons why, as you alluded to, where you have more incidence of the cold or the flu in winter months is for a variety of reasons. First of all, in wintertime, people tend to be indoors and they are in closer proximity. And how our virus is transmitted, that's done in two main ways. It's through droplets. So when somebody coughs or sneezes and those tiny little droplets land on your mucous membranes, that can expose you to the virus. And the second way is by touching other surfaces that are infected. In the wintertime, you have more of both because people are very close to each other. Additionally, these viruses are little particles with a lipid envelope surrounding them. They tend to be a little bit more stable when the weather is cold and when it's more dry.
I see.
On the same frequency, your nasal passages tend to dry out in the winter months as well, which means that that natural defense where you have mucus and moisture to stop those virus particles from reaching your body is diminished. The rhinovirus actually prefers to live in your nose where the temperature is slightly lower, and it actually replicates better in those conditions, which is part of the reason why your body mounts a fever type response in response to that.
I see. So just to simplify things, I think what I'm gathering is one way of prevention is to make sure that we're constantly washing our hands, to make sure that if we have touched any surfaces that might have the virus, that we can prevent that. And maybe the other thing being having a humidifier. I know I do, because I'm definitely experiencing having like dry nasal passages when I'm awake, dry throat. So having a humidifier might help.
You got it.
Yep.
Staying hydrated as well.
Okay.
So one more thing, let's talk vitamin D. In the wintertime, we're indoors all the time and not getting adequate sunlight, and our vitamin D levels tend to drop during the winter months. There has been an association with decreased vitamin D levels and upper respiratory tract infections. One thing you can definitely do is to get plenty of natural light during daylight hours. And also, we can check vitamin D levels. And if your vitamin D level is low or suboptimal, you can supplement.
Now, what is suboptimal? What level? If I'm looking at my blood work, because I don't know what anything means, what number am I looking for to be considered optimal or normal?
So this might vary depending on the specific lab, but the lower limit of normal tends to be in the range of around 30 nanograms per ml.
Okay.
If you want to be optimal, you want to be higher in the closer to the 80 range.
So I don't have any more questions regarding cold and flu. Is there anything else that you would like to add?
Yes. So I think in terms of supplements, everybody wants to know what can you take once you get a cold and flu. I would say that some of the best supplements you could take would be a zinc supplement. Zinc has been shown in a number of studies to actually decrease the length of an acute illness when you have the cold and flu. This is easily taken in a capsule or pill form in the range of 100 milligrams of zinc once or twice a day, only for the short term when you're sick. Zinc does tend to cause a little bit of upset stomach or nausea, so it should be taken with food. Additionally, I mentioned vitamin D, but a lot of the supplements that you can take, I think, have to be individualized because there's not always good research to show that it's beneficial. However, certain people find that certain things work better for them. Some people really like to take echinacea. I also like to take N-acetylcysteine, which is a precursor.
What is that? I'm sorry, rewind, because I don't know what that is.
N-acetylcysteine, or NAC, is a precursor molecule to your body's main antioxidant called glutathione.
Okay, that I know.
And so a lot of people have actually think that it is beneficial for you in the midst of an acute illness to take this because it helps to thin your mucus and it helps to provide additional antioxidant support to your body to fight off these illnesses.
That's a good amount of supplements. Thank you so much for answering all of my questions regarding cold and flu season, and I look forward to seeing you on more podcasts.
Thank you for having me on.
This podcast is sponsored and brought to you by One Body Medicine. You can learn more by visiting onebodymedicine.com. That's the number 1, bodymedicine.com. You can also follow the show on social media under the handle Pure Wellness Pod. Thank you for listening, and we'll see you next time.